All right, guys. So now we're getting into the cardiovascular system. If you haven't viewed the respiratory system yet, I'll give the same quick little spiel I did with that one. The cardiovascular system and the respiratory system work hand in hand together. They work to remove wastes, and they work to transport oxygen as well as other substances into the body to in the case of the cardiovascular system, supply the rest of the bodily tissues. These two systems are heavily related, especially in terms of getting oxygen into the body, because the respiratory system brings in the air at the alveoli of the lung, the oxygen, utilizing a term from physics called partial pressures, will diffuse into the blood, while carbon dioxide will diffuse out of the blood and into the alveoli where it becomes exhaled. And the oxygen will bind to a red blood cell, to a special part of the red blood cell where hemoglobin is contained, and it will then travel to a specific cell. All right, so what we see here. Introduction to the cardiovascular system. So, big thing to note is we essentially have two parts here. We have the actual heart, and then we have the circulatory system. The circulatory system can also be further divided into a couple smaller subdivisions. One of the main ones is the pulmonary circuit. As you'll see here, just like the bronchi in the lungs, the blood vessels that enter into the lungs, the artery and veins that go to the lungs and from the lungs need supplied oxygen for both their own tissue function, but it also needs to get blood in order to oxygenate that blood, okay? So the lung is essentially providing its own oxygen to itself, just like the heart actually has blood vessels on the surface of the heart. These are called coronary vessels, and it's the coronary circulation. And this is what you see when you see like bypasses. So you would get a coronary heart bypass, and you would be bypassing artificially blood vessels in the heart. Another big important little subdivision we would essentially call the peripheral or systemic circulation. And the peripheral and systemic circulation kind of can have a couple different smaller divisions on it, but they're not that important for this course. It's important to also note a couple of the main blood vessels coming directly out of the heart with oxygenated blood is the aorta. And the venous blood that is deoxygenated will return to the heart via the inferior and the superior vena cava. Those are the primary blood vessels that return deoxygenated blood to the heart. Now, there's other very important arteries like the carotid. Combined with the vertebral arteries, supply blood to the brain, so they're very important. And the femoral artery is very, very large, and supplies blood to the lower leg. So what you see here essentially is a quick and dirty diagram of blood flow. So deoxygenated blood enters the heart, travels through the right side of the heart, and then it enters the pulmonary trunk. From the pulmonary trunk, it gets split up to the left, right lung. It gets oxygenated, comes back via the pulmonary vein, which, fun fact, is the only veins in the body that carries oxygenated blood. Because remember, veins is just the term for vessels that carry blood back to the heart. It's not necessarily, and again, generally it's deoxygenated blood, but in our exact scenario here, it's actually not. Then goes through the left side of the heart, and then up to the aorta, where it will continue down to the abdomen via the abdominal aorta, or it can branch off to the subclavian, etc. Oxygenated blood travels. It's going to enter various smaller and smaller artery types. So you might get to arterioles. And then from there, you reach what's called a capillary. Capillaries are one cell wall thick. They're very thin. In fact, capillaries essentially have holes in their walls. And these holes are big enough to allow the red blood cells to sort of diffuse out. And then from that point, through some various processes, oxygen gets unloaded from the red blood cell and waste can get loaded onto the red blood cell. The heart can transport about pump about 5 liters of blood per minute. So we're looking here at the heart. We're going to go real quick through some of the anatomy of the heart because it's going to be important for terminology. So we see the vena cava here, superior vena cava, inferior vena cava. These are going to dump into what's called the right atrium. So the atria is plural. The atria is the top chambers of the heart, and the heart has 4 chambers. There's 2 on the right, 2 on the left. The top are called atria. The bottom are called ventricles. All right. Atria are smaller. Ventricles are much larger, have more muscle as well. Now, blood, deoxygenated blood, enters the heart via the 2 vena cavas into the right atrium. All right. As the heart contracts, it gets pushed through what's called the tricuspid valve. All right. It's called tricuspid because what does tri mean? It means 3. The tricuspid valve, if you open a heart up, literally has 3 flaps to it. All right. These flaps here are held to the wall of the heart. But we're now into the right ventricle. From the right ventricle, there's a big push of blood into the pulmonary artery. Because remember, arteries carry blood away from the heart. This artery is deoxygenated. Same concept as the pulmonary vein, but in reverse. Goes to the lung, gets reoxygenated, and then gets pushed back into the heart. At this point, the pulmonary vein will dump into the left atria. We have another contraction of the atria. Blood is pushed into the left ventricle. And this is where the big push happens. If you look at the myocardium, the heart muscle right here, illustrated by this light pinkish color, it's much larger in the in the left ventricular wall. There's a big push here, and it goes out through the aortic valve and through the aorta to the rest of the body. This is a very forceful push right here, okay? The valve in between the left atria and the left ventricle is called the mitral valve, but it sometimes is also referred to as the bicuspid valve because it only has 2 cusps, all right? So, moving on. So functions, the cardiovascular system obviously is to pump blood, transport oxygen, nutrients, immune substances. It carries waste production away from the tissue, and this means that it's going to carry waste to the kidney for filtration. The kidney is also going to play a role in regulating blood volume, and it also helps regulate the number of red blood cells that exist through a hormone called erythropoietin. The blood is filtered by the liver to remove a lot of waste. It's very important. So, blood, composition-wise, blood is relatively close to 8% of the body weight. There's 2 main divisions of blood. There's plasma and what's called the formed elements. Plasma is essentially what we would call the liquid component of blood. It's 90% water, all right? 10% of it is what we refer to as solutes. So these solutes are essentially different things like salts, various substances in the blood. You know, any nutrient that needs to get moved can be proteins that are attached to specific transport molecules, things of that nature. Then we have what's called the formed elements. And formed elements are those that originate from cellular material. And I say originate because they're actually not all formed elements are actually fully functioning cells. Thrombocytes are also commonly known as platelets. And thrombocytes are actually just fragments of a cell that has ruptured. They play a major role in clotting of blood to stop bleeding. But we also have, with platelets, leukocytes. Leuko meaning white, cyte meaning cell. These are white blood cells, okay? And there's many categories of white blood cells. They all serve slightly different purposes and are in very different quantities. What you have is represented by this peachish color is what's called the buffy coat. That's going to be the leukocytes and the thrombocytes. And finally, the erythrocytes. Erythrocytes can be about 35, 40-ish% of the blood. Eryth, meaning red, cyte, meaning cell, red blood cells. This is where the magic happens for carrying oxygen. So, combining forms, adeno means gland. Angio means vessel. So, if we're really talking about a blood vessel. Arterio is going to apply to artery. Cardio is heart. Echo is a sound. So we can do what's called an echocardiogram, where we look at the sounds of the heart. And I say look because it actually is a visual test. So going into combining forms, electro, we're talking about electrical activity, and brings up a point that the heart actually functions based on electrical activity. Believe it or not, you can cut off all nervous supply to the heart, and the heart will beat on its own. This is actually how you're able to do a heart transplant. You do not need the nervous system for the heart to function. There's a very special spot on the heart called the SA node. The SA node is commonly referred to as the natural pacemaker. If your SA node goes bad or stops functioning properly, that's when you get an artificial pacemaker placed into the body. Now, before that artificial pacemaker gets placed into the body, if the SA node is dysfunctioning, there's another backup to that called the AV node. The AV node primarily is going to serve to function to slow down electrical impulses. And it does this because the atria and the ventricles should not contract at the same time, because you would actually not pump blood that way. The atria has to go first. The AV node kind of acts like a resistor where it slows down the electrical signal, and we're talking milliseconds here, and then it continues on. The SA node can set the heart rate naturally at about 60 or at about 60-ish to 100 beats per minute. The AV node is going to set the heart rate at about 45 beats per minute, and that would actually technically be called bradycardia, or slow heartbeat. But it gets even better because there's a third backup. There's something further on down the electrical line called Purkinje fibers, and these are an absolute last resort. If your SA node's not working, your AV node's not working, these can set your heart rate at 15 beats per minute. This would be incredibly dangerous for how slow it would be, and you'd probably not live very long. Okay, off that sidetrack. Lympho, talking about lymph, or like lymph nodes. Phlebo or veno is talking about veins. We can talk about phlebotomy, is like the act of drawing blood. Spleno is referring to the spleen, another abdominal organ. Thrombo, talking about clotting. Ac, pertaining to graph, an instrument used to record. Megaly is an enlargement. We can have cardiomegaly. Sarcopenia, again, abnormal reduction, like like previously we had the term sarcopenia. You can have leukopenia, so a reduction in white blood cells. Sclerosis is a hardening, so we can have atherosclerosis, which is a condition where the blood vessels, or specifically arteries, harden. Prefix is Brady, as I mentioned before, is slow. Tachy is the exact opposite. So we talk about tachycardia, we're talking about a rapid or fast heartbeat. Tachycardia is defined as a heartbeat greater than 100 beats per minute. So again, here's some terms: arterial, arteriosclerosis, as I mentioned already. Bradycardia, slow heart rate. Cardiac, just pertaining to the heart. Cardiologist is a specialist that discusses the heart. Cardiology is the study of the heart. Cardiomegaly is an enlargement of the heart. Next, what we have here is a thrombosis. Thrombosis is a clot. All right. This is what we normally see. You can talk about this in very different ways, but what you'll see here is plaque can build up on the inside of the heart, and abnormal clotting can occur and block off the blood vessels. This can cause various different conditions. In the heart, if the blood flow is cut off long enough, you end up with what's called a heart attack. All right. If the clot breaks free here and travels to the lung, for instance, and gets caught in the lung, you'll have a pulmonary embolism. If the clot breaks free and travels to the brain and blocks an artery in the brain, you end up with what's called a stroke. Cardiomyopathy is a description of a condition where there's a disease of the heart muscle. Hematologist is someone who studies blood. Hematology is the study of blood. Hematoma is commonly referred to as a bruise, but you could think about it as a swelling of blood. Hemostasis is the regulation of blood. Intravenous is within the venous, within the vein. So again, IV, intravenous. Leukocytopenia is a reduction in white blood cells. Lymphadenitis, very specific lymphatic condition involving inflammation of the lymph nodes. Lymphadenopathy, again, we talk about pathy. It's a disease of the lymph node. So when lymph is combined with adeno, we're specifically talking about lymph nodes. Lymphoma is a cancer of the lymph nodes. Myocardial is a generalized term to talk about heart muscle. Phlebitis is a inflammation of the veins. Splenomegaly, very, very potentially dangerous condition. Spleen is heavily involved in blood formation, so there's a lot of blood in the spleen. This is talking about enlargement of the spleen, and we talk about like splenomegaly in like conditions like mononucleosis or mono. If your spleen ruptures, you're going to internally bleed a lot. Tachycardia, fast heart rate. Tachypnea is fast breathing. Thrombocyte is is the cell that exists before it breaks up to form platelets. Thrombocytopenia is what we would talk about as a abnormal reduction in platelets. Thrombogenic, we're talking about something that originates from a thrombocyte. Thrombophlebitis, inflammation of the vein with thrombocytes. Thrombosis. So diagnostically, we talk about angiography. So we're essentially graphing or mapping out the blood vessels. Arteriogram, again, we're measuring the arteries. Electrocardiogram, also known as ECG or EKG, same thing. We're measuring the electrical activity of the heart. Electrocardiograph is the graph that gets made from that. Electrocardiography, again, is just the process of doing that. Venogram, an arteriogram, very similar, and we'll see an example of that right here. So, remember the chest x-ray that we did before? Essentially what we can do is use various different substances where we can actually make blood vessels highlighted on an x-ray. So remember the chest x-ray, this is the lung. We can see all the lucent space. You got the ribs coming across here. You can see thoracic vertebrae down here. And you can make out kind of the split of the pulmonary trunk coming off the heart, because the heart would be this shadow right here. The pulmonary trunk, the right side here, left side is right here. And you can see the branches of the blood vessels as it enters into the lung. What you'll see here, coming from the abdominal aorta, it's going to bifurcate, and you'll have two common iliacs. Or actually, sorry, this is a vein, so we're going backwards. So you got the popliteal. The popliteal vein is on the posterior side of the knee space. Kind of wraps around a bit and turns into what's called the femoral vein. And then it's going to turn into the external iliac, common iliac, and then the two common iliacs, right and left, will form a inferior vena cava. Electrocardiogram. So this is a fun one here. What you see, and it's a little hard to make out here, so I suggest you pull up another picture or you look at the supplemental material for the week. But we're looking at the activity of the heart. All right. So what you see, breakdown of this really quickly. The first little wave right here is called the P wave. This is the electrical discharge of the atria. Remember how there's a small pause between the atria and the ventricles contracting? So we see that pause here. And this big spike, because remember how much larger the ventricles are. This big spike is the ventricles contracting. Okay? Now, we see one more small little wave here. And again, this big wave is actually called the QRS complex. And then this last wave right there called the T wave. And what the T wave does is it actually shows what's called repolarization of the ventricles. You can just think of repolarization as the electrical activity kind of, you can think about it as kind of the muscles recharging, all right? We don't see the atria doing that because it's actually hidden by the QRS complex, okay? So, again, angioplasty, phlebotomy, endarterectomy, splenectomy, removal of the spleen. So, anemia, aneurysm, blood pressure, cardiac catheterization, cardiopulmonary resuscitation, also known as CPR, complete blood count, or CBC, coronary artery bypass graft, coronary artery disease, and embolus, and then heart failure. So, if we're talking about a aneurysm, in general, an aneurysm is a weakening of an arterial wall that's going to allow the arterial wall to expand like you see in this picture. The wall becomes weak. A lot of times there's going to be a fatty layer that lines the inside of it, and this can rupture. And it can happen at any point and for literally no reason. And if it happens, like for instance, in your abdominal aorta, you will literally die in seconds, okay? You will lose all blood pressure to the body, and you will die very, very quickly. Cardiac catheterization is a procedure where a catheter gets inserted into the body. It can happen for a couple different reasons, but it's normally involved in examining it can be resetting the heartbeat, a couple different things. So a thrombus or an embolus. So remember that a thrombus is a clot that's still attached to the wall, whereas an embolus has broken free and can get trapped somewhere else. In the brain, both of these essentially lead to a stroke. Hemorrhage is a excess amount of bleeding. Remember rhagia? We're talking about hemorrhagia or hemorrhage. Hypertension is high blood pressure. Hypotension is low blood pressure. Leukemia is a cancer of white blood cells. A myocardial infarction is the correct terminology for a heart attack, which, remember, a heart attack is caused by the sudden death of cardiac tissue linked to a blockage of the coronary circulation. The pulse, so that's the ability to actually feel the heartbeat. A sphygmomanometer. Fun word. It is literally it's the tool that's used to take blood pressure. Stethoscope is used for listening. So when you perform what's called auscultation, the stethoscope is a tool for listening. Varicose veins are a diseased vein condition where the valve within the vein kind of collapses and you end up with excess pooling of blood in veins. Normally happens in the lower body in severely overweight individuals. Venipuncture is literally just the procedure where you're inserting a needle into the vein. So again, here you can see a stethoscope. In this case, they're using the stethoscope to listen to the pulse to take blood pressure. The idea behind doing this, when you fill the blood pressure cuff up, you will not hear the heartbeat after a certain point. You start to let air out of the cuff, and you note the first number on the sphygmomanometer when you start to hear heart sounds, and eventually the pressure decreases to a point where you can no longer hear the heart sounds, and that is the next number that you record. The first number becomes what's called diastolic blood pressure, and the bottom number is the systolic blood pressure, and together they make up the total blood pressure reading, and a normal blood pressure reading is 120/80. Varicose veins, this is a very extreme example right here. Abbreviations, BP. We'll go through this. You should be able to know what a lot of this is. What we see with BP, we talk about blood pressure. A fun one, CABG, often pronounced as cabbage by cardiac surgeons. It's a cardiac bypass graft. CAD is coronary artery disease. CBC, complete blood count. CPR is cardiopulmonary resuscitation. An echo is essentially just an echocardiogram. An ECG or EKG is electrocardiogram. The K is used because of the German word, but we've since gone. They're both acceptable. IV is intravenous. MI, myocardial infarction. So what are the abbreviations for this specific test that's on here? ECG or EKG. So CPR, we've gone through CPR, CBC, cabbage, HF, heart failure, and HTN, you can say hypertension. And that is it for the cardiovascular vocabulary.